Hello, my name is Evelyn Carrillo, and this is my critical assignment presentation. Now, before we get started, I'm going to go a little bit over about my patient, Jose Salas. Jose Salas is 47 years old. He weighs 190 pounds. And before we did a 8-week training program, I did use a couple of assessments to detect his health history. Now, one of those assessments that I used to detect his history was a physical activity readiness questionnaire and a functional movement screening assessment. Now, the physical activity readiness questionnaire is used by medical professionals in evaluating the patient's health history and mobility, whereas the functional movement screening is also used by medical professionals, but it detects more of injuries and how to prevent injuries in the future. So, based on the results of these assessments that my patient presented, I did find that he is considered obese. He weighs 190 pounds. His body mass is above, unfortunately, the obesity level there. And he does present symptoms of high blood pressure. Now, again, I'm not a profession, therefore, I can't really diagnose him. However, based on these assessments and based on his responses to these assessments, he does show some symptoms and results of high blood pressure. Now, for the functional movement screening, there are a variety of FMS assessments to do. It all depends on what type of patient you're dealing with, whether they're athletic, elderly, disabled. The most common functional movement screening can include a muscular skeletal screening. It can include the comprehensive athletic screening evaluation as well. So again, these FMNs vary depending on what type of patient you're dealing with. In conclusion to the results that my patient Jose did show, I did design an 8-week training program that consisted of high intensity interval training circuits and included cardiovascular endurance as well. So a couple of those examples for the high interval training circuits do include body weight squats, body weight squat jumps, resistant band exercises, a lot of cardiovascular. I did not want to implement any heavy weight only because I am dealing with a patient that's a little bit older and his muscle strength is not necessarily there. So he has to build up to that. And I don't want him to have any injuries if I were to implement a heavyweight body composition workout for him. So again, the primary fitness goal here for my patient Jose was to lose weight, and we came to the conclusion of him losing 10 pounds within the course of the 8-week training program, which is very reasonable. Now, the training style I have chosen for his 8-week training program do include linear and non-linear. So there's exercises selections vary from multi-joint, from range and motion, again, high intensity interval circuits, cardio. There's a variety of many things involved within his program. The exercise order does begin and will finish with the warm-up, and the reason I want him to begin and finish with the warm-up is to prevent any injuries. It's very important for my patient to stretch those muscles that are going to be used during that exercise so there is no injuries or we don't cause any more tear and damage to any muscles that may be already sore. In conclusion, the exercises will be completed 5 times a week. Now, with that being said, cardiovascular exercises are only Tuesdays and Thursdays. High interval training circuits are Monday, Wednesdays, and Fridays. And my patient will have Saturday and Sunday off as a rest day to stretch out his body and re-energize for the following week. Now, the intensity of the exercises vary depending on the workout and the day of the week. So we're talking about an intensity that can vary from 60% of resting heart rate all the way up to 90% of resting heart rate. So again, it all depends on the type of day, the week, and the workout that is implemented for my patient. For example, maybe in week 8, I mentioned 70% resting heart rate running 1 mile. Or another example is running sprints, 40-yard sprints at a 65% resting heart rate with maybe like a 1-minute resting period. Other exercises implemented during my patient's 8-week training program do include heavy weight. And it's not necessarily heavy weight, it's dumbbell exercises. And the reason why I want to use dumbbell exercises is to do increase that muscular endurance and his strength as well. Now, keep in mind the dumbbell weights do vary based on your patient. Now, again, I'm dealing with an older patient here. Therefore, I'm going to start with his dumbbell weight to be at 15 pounds for the first couple of weeks. And the reason why it's going to be at 15 pounds is because for the interval circuit training, he's doing more repetitions. If I were to do it at a higher weight there for the dumbbell, it'll be a lot more difficult for him to complete those reps, and he wouldn't be able to complete the entire course for the day. And again, for interval training circuit, we want to start at a high number of repetitions and sets and slowly decrease throughout the week. So as the number of repetitions and sets decrease throughout the weeks, the weight in the pounds will increase for my patient. So for the first couple of 2 weeks, he'll start at 15 and gradually increase 5 pounds per week. So by the end of the course there, he might be lifting up to 30 pounds, depending on his strength and ability, of course. Now, the progression again involved in my 8-week training program does include high repetitions, high number of sets, and slowly, gradually decrease. Now, for my cardiovascular days and workouts, it'll begin at a lower number of repetitions and sets and then slowly increase. Now you can see here in the next couple of slides, it just gives you an overview of the warm-up I have implemented for my patient, the type of training program that's involved, the exercises that are involved, body weight squats, resistant band workouts that involve internal, external rotation, leg press, jump squats, sprints, mount climbers, jumping jacks. So there's a variety of many exercises that I have implemented here for my patient. Now, in addition to the 8-week training program, it is very important for my patient to be able to complete these exercises to the best of his ability, but make sure he's completing them correctly as well. So with that being said, an example I had him do before beginning the program was a body weight squat. Now, a body weight squat is a lower extremity workout, and according to the National Strength and Conditioning Association, you want to make sure that your patient starts in a good balanced position, and their feet are on the ground. They're okay. They're not feeling fatigued at all. If you have any type of body weight structures like a squat or walking lunges, make sure your patient does that beforehand. And for a squat, you want to make sure they bend at their hips, not their back. If they do happen to bend at their back, they might cause some damage and injuries there to their spine as well. So here on the slide, it gives you a little overview of the proper steps on how to do a basic squat here. So again, this is all according to the National Strength and Conditioning Association. And pictures here referenced to the right as well. You'll notice that my patient unfortunately did have a couple of mistakes when first doing a squat. His knees were over his toes. And as an instructor, you want to make sure that your patient's doing things correctly. Therefore, I had to notify him, drop your hips back a little bit more towards your calves. We don't want your knees going over your toes. So in the next slide, you'll notice that the huge improvement where his hips actually went back towards his calves and his torso was more in an upright position. Therefore, his knees stayed behind his toes, which was a huge improvement for him. And it was great for me as a trainer to see that as well. Additionally, another exercise that we worked on was a push-up. So a push-up can be tough if your patient doesn't have any upper body strength. Now, according to the American College of Sports Medicine here, the fundamentals of a basic push-up, you want to begin with your patient starting in a prone position. And what I mean by that is make sure they're lying flat on their stomach on the ground. And you want to have them place their elbows to the side of their stomach with their palms facing down. So you don't want their elbows flingering outward. You don't want them out in front of their shoulders either. That's just going to cause a lot of damaged tissue to their shoulders. With that being said, it's very straight to the point here doing a push-up. You want to bend the elbows to at least 75 to 90 degree angle. You want to make sure that your patient maintains a straight back. Common effects here and problems that you'll see with patients doing a push-up, if they don't have that upper body strength, they'll tend to either lift their hips up in the air or drop their hips downward towards the ground. Additionally, you'll also notice that when they start feeling tired, they'll slouch their shoulders over their head and they'll drop their neck downward, which unfortunately my patient did happen to do. So again, we corrected those little mistakes, and you'll be able to see the difference between the before and after from my patient. So it was a huge adjustment there. He was more he was a lot stronger, and his elbows were more flexed there, so he had a lot better balance than the first time doing a push-up. Now, with that being said, as I came to the end of this course of the 7-week training program here, there's many things I have learned, and one of them was being understanding. And what I mean by that is I used a lot of fundamentals as a trainer to assess, apply, adapt, develop, and execute a training program. And as my future goal to become a physical therapist, I've learned to slowly use those fundamentals into progressing a developmental plan for patients in the near future. For example, if I really want to be a physical therapist, I'm going to be dealing with a lot of patients, and every patient is going to be differently. So with that being said, I have to develop some type of rehabilitation program, methods, and exercises to meet my patients' needs, because not everyone's going to be the same. Not everyone's going to have the same injury. Therefore, I need to understand and teach my patients what's going to be done, the methods that's going to be used, the exercises that are going to be implemented, and make sure they're understanding as well. So it's a little bit of teaching and learning as I, plan for this future and plan to be a future physical therapist. But again, I learned the fundamentals of assessing, applying, developing, and executing a 8-week training program, which will help me in the near future as a physical therapist. With that being said, I think for any professionals working in a clinical or exercising environment, it's very important for professionals to keep a very positive mind and use the word of the Lord as guidance. And what I mean by that is not every day is going to be a good day. We're all going to have some rough patches along the road. We may have a patient that may come in with a negative outlook just because they've suffered from an injury, or they have some self-esteem issues, do not know how to exercise correctly. Therefore, it's important for us as trainers, humans, future professionals in any type of field, to keep a positive mind and trust in the Lord, trust in His power, trust that He gave us a purpose, and we need to use that purpose to better the life of others and serve others to make sure they meet their needs and they accomplish their goals along the way as well. With that being said, folks, this concludes my presentation. I want to thank you for taking the time to go over this PowerPoint presentation with me. I hope you have enjoyed your time as much as I have.